Thank you for choosing Axxess On Demand. Axxess believes in continuing education, and we create content to empower you to learn and grow anytime, anywhere. Let's get started.
Hello, and thank you for joining the Axxess Hospice On Demand training webinar on the medication profile. We're going to start this as how we enter our medications from the admission assessment. We will also review how to update your medication profile on a patient after admission. Before we enter the medications, I do want to show you how to add the allergies. So select the Add Allergy button from your admission profile, and it will take you to the patient's allergy profile. The allergy profile can always be found in the quick links in the patient's chart as well. And that is how you will update them during the care of the patient. If your patient has no known allergies, simply select the button that says No Known Allergies and enter your start date, who gave you the information, and any comments about the no known allergies. To add an allergy, select Add Allergy. Enter the allergy that the patient has. Also add the reaction. And then determine if the allergy is related to a medication, an entire medication group. That would be, for example, if you have an allergy to morphine versus an allergy to all opiates. If this is a food allergy or an environmental allergy or a different type of allergy. Select the severity of the allergy. Note that severity and information source are not required fields. The required fields are the ones with the red asterisks. Enter your start date for your allergy. And then you will save your allergy. If you need to enter multiple allergies, you can select Save and add another. If at some point you need to deactivate your allergy, perhaps you have a listed allergy to a medication and you find out later that it is not accurate, it might be an intolerance or a side effect as opposed to an actual allergy, you can deactivate the allergy by putting in the end date. That will move your allergy to the inactive allergies part of the profile. Now you'll see on the admission profile, your allergy will show up here. On all of the clinical documents for nurses, there is a button that says Review Medication Profile. This will take you from the admission assessment or any other assessment to the patient's medication profile. In the admission assessment and the recertification visit, when you go to Review Medication Profile, it will not generate an additional physician order. These will go to your assessment and your initial plan of care or your recertification plan of care. On routine visits, it will require the order to be attached to a physician order, which we will go over after we go over how to do it from the admission. So when we're going to add the medications, select Add Medication. You can see lots and lots of required fields here. So the medication list that we pull from has thousands and thousands of medications. If you try to enter a medication and you are getting something that says add as custom medication, it is likely that you've entered the medication incorrectly. There are some medications that will need to be added as custom medications, such as if you're using Insure, for example, or something like that. Those are not inside the medication list that we have. But Pretty much everything else is going to be in here. So please be careful if you see add as custom medication. It is likely that you are misspelling the medication or you are using a slash instead of a dash. Or you may be putting the milligrams next to the number without a space, which will show, and I will show that to you in a minute. So we're going to say this patient is on Cinemet. The classifications will pull from the drug database as well. Enter your start date of the medication. If this is a titration, for example, like you're on a steroid and titrating down, or if it's an antibiotic where you already know the discontinue date, you can enter the discontinue date when you get your initial order, and the medication will discontinue on the selected date automatically. Enter your dosage and your route. If the medication is going to be covered by hospice, select the button right here. Enter the indication, which is the reason why the patient is taking the medication, either the disease process or the symptom that the medication is for. And then enter who is going to be able to administer the medication. If you are only entering one medication, you would select Save Medication. If you are adding multiples, you would select Save and add another. Whenever you add medications, an automatic drug interaction test is done. So there's only one medication, so it's showing there's not an issue. Let's add another medication. So I entered Seroquel. And let's say I want to add Seroquel, and you see all of the ones that show up, and I say 25 mg without the space. It's going to say add as a custom medication. Well, we know that Seroquel 25 milligrams is a commonly used medication dose. So try and see if perhaps you spelled it wrong. See, if I back off here and just take off the mg right next to the 25, it shows up. We are going to save and add another. And you can see, just as I added the second medication, it's already showing that there's a moderate drug interaction between Cinemet and Seroquel. Now let's add some levothyroxine. Since we said this patient does have hypothyroid, I am not going to select this medication is covered by hospice. I'm going to leave that blank because, as we said when we were reviewing the diagnoses, we said that the hypothyroidism is not related to the terminal prognosis or symptom burden of the patient. So I'm going to save the medication. And you can see that the medications that I said were covered by hospice have this green hospice with the check mark. And the one that we said is not covered by hospice has the red X in the red hospice. So you can see easily by looking at the medication profile what medications are covered by hospice and what medications are not. You can also see by hovering over this icon what the classification of the medication is that you selected. And the rest of the instructions of how to give the medication are listed here with the medicine. The indication is here and the start date is showing here. If there was a discontinue date, it would be right underneath here. And who's administering the medication is showing here. The edit allows you to do a few different functions. One is you can update the indication, who's going to be administering the medication, and if the medication is covered by hospice or not. Any other changes need to be done with a new physician's order. To print the medication profile, select the button here that says Print Medication Profile. The PDF will come into your download folder where you can view it and then be able to print this to give to your patient. To view what the moderate drug interaction is for the medications that we just entered, or if any reactions are showing, select the Detailed Drug Interaction Report. This will let you know that Sinemet and Seroquel, they're saying it may antagonize the effects of the Seroquel might have a problem with your Sinemet. Depending on your policy at your organization, inform your physician of anything that is significant that he needs to know when ordering the medications. To sign the medication profile, select the purple button on the Medication Profile tab. This will bring up the medication list as well as the attending physician, the terminal diagnosis, and all comorbidities. You can view the drug interactions. Any active allergies will be on here as well. And then at the bottom, you will see the medication regimen review acknowledgement. This is showing that you have reviewed everything for any adverse effects and drug reactions, ineffective drug therapy, side effects, drug interactions, duplicate drug therapy, allergies, and noncompliance, and reviewed significant findings with the physician. Follow your organizational policy as to how often this should be done and by whom. This is also recommended that the physicians review this and sign this at IDGs or at least on admission and recert. Then once you've signed your medication profile, it will be saved in your signed medication profile section. Once you've completed entering your medications on admission, you'll return to the assessment and your medications will be entered here. We're going to leave this assessment for a moment and go into an active patient to show how to change the medication profile. So I'm going to go into Jane here. And in the quick links, you will see medication as an option. You also can get to the medication profile from inside of your clinical notes for nurses when you select the review medication profile. And you also can come from a physician order by selecting the medications button inside the physician order document. To make any changes to the medication profile after admission or when not in a recert assessment, select the Update Medications button. It will require you to have a physician order associated with any medication changes, as medication changes must be ordered by a physician. If you are coming from a physician order, you will see that it will say update medications as opposed to add medications. Select the physician who's giving you the orders. And now you see add medication is here. You also see the purple stripe that says the updates will be added to this physician order document that's scheduled on this day. If I wish to discontinue a medication, multiple medications, I can select this and discontinue all of them in bulk. To make a change to a specific medication, we can use the three buttons right here and say either titrate or discontinue. So we're going to start with how to titrate, which means you're going to go up or you're going to go down on the medication. You're changing the dose of an existing medication. So the titrate first will enter a discontinue for your current order. So in this case, it's morphine 20 milligrams per milliliter, half of a milliliter every 2 hours PRN. So we're going to discontinue this medication. And since we selected titrate, first, the discontinued medication comes down to the bottom, which here it is right here. We said that it was discontinued today, and this is the doctor who gave the discontinue order. And the entire medication order shows up exactly as it was entered before, except there is no start date. So we're going to put in the start date and make the changes. So we're going to go up to 1 milliliter sublingual or by mouth every 2 hours as needed. Make any changes as to who's administering the medication if needed and any coverage. But with titrate, you can make changes to any section of the order that you need to, either up or down, or perhaps changing the format. Like maybe you're going from a hydrocodone acetaminophen 5 to a hydrocodone acetaminophen 10. When you save the medication, you will now see the new medication order is here. And the old medication order is down here. To discontinue a medication, you would simply hit the three dots and say discontinue. You also can select the box over here and hit discontinue selected. Either way, what you will get is the discontinue date you can enter here. It is editable. And the physician that's associated with the order that we created is going to be the discontinued physician. Select discontinue medication, and the medication will come to the bottom with your discontinue date. So in order to show you restart, we're going to discontinue a medication. So let's say that the family said they don't want to give the Senna anymore. So they absolutely don't want it. And we're going to say they discontinued it last week. So now that medication is down here at the bottom, that it was discontinued. Now let's say, as often happens when people want to discontinue a medication, that they realize they need to have it back. We're going to use restart. So to restart a medication that was discontinued, select restart And the medication, the entire order, the way it was before, is going to be put up here in the add medication, just like it was for titrate, without a start date. So put in the start date for restarting the medication. Any other changes you need to make, you can add as well. And then select Save Medication. And then the medication that we discontinued will still show on the discontinued because it was discontinued, but now we have it starting again on the day that we said to restart it. And as always, the drug interaction check is happening during the entire time. Once you are completed with making your medication changes, and if you have no other orders, you can go in to View Order to complete your physician order. Enter the time that you received the orders, and all the medication changes we made on this existing patient will automatically show up on the physician order. If you started in the physician order, remember I said you could use the medication button in your order to be able to go to the medication profile in an editable format. So you can see when I come from the order, I have this purple stripe here saying I'm already going to attach all of these changes to this order. If you have other orders to complete for this patient, do not complete your order. Complete your order after all of your orders are completed. So for example, if you're changing plan of care, frequencies, level of care, diagnoses, supplies, DME, activity, diet, or other orders, complete all orders on one physician document to make it easier for your physician to sign one order. For information about how to change all of the different types of physician's orders, please view the Physician Order Clinical Documentation webinar. For plan of care and frequency, you can view the IDG Preparation for Clinicians webinar.
Thank you for joining our on-demand training today. Axxess is the only home healthcare technology company approved by the American Nurses Credentialing Center to offer continuing education credits and the most recommended home health software on Software Advice. You can watch more on-demand training videos through our industry-leading help center or at axxess.com, where you'll find tutorials, blogs, white papers, and answers to frequently asked questions. Axxess, empowering care anytime, anywhere.